I live and work on the lands of the Kulin Nations in Melbourne, which is the traditional lands of the Wurundjeri people. And I'm very pleased to pay my respects to the traditional custodians of those lands and to acknowledge that they were never ceded. We're working to really understand what evidence is available from the 3 focus countries that CEVAW has about the nature of experiences of violence against women and girls, how common these are, and what factors have been associated with them. In particular, are there risk or protective factors that can be influenced by policies or programs? So the method that we use is to do what are called systematic reviews, so searching the existing published literature in a very systematic and replicable way to identify what published data there are in these areas. And we've done this with cross-node, cross-disciplinary and cross-national groups, and they've been terrific, but as you can imagine, sometimes administratively a bit complex to bring everyone together. And what we've found so far is that there are big disparities in the availability of data from these different countries, and there are big disparities in the quality of that data. So this method appraises critically the quality and reliability of the data that are available. So the one we've progressed furthest with is the one from Fiji. And we acknowledge Fiji has quite a small population. It doesn't have a deep academic base of research in this area, but there are only 13 papers available from Fiji that have been published in the peer-reviewed literature, none of which actually describe national data on the nature, prevalence and determinants of violence against women and girls. And so this is quite a sensitive finding. There has been some research done, but it's only made available in the form of technical reports that are not subject to peer review. So in both Vietnam and Indonesia, the other 2 focus countries, more data are available, but predominantly they are of vulnerable subgroups. So there's been work, for example, done particularly with sex workers or injecting drug users or people who are patients in psychiatric hospitals or particular ethnic or tribal groups. But this actual national picture is proving to be more elusive than we realised, and that of course informs where we go next. All the 3 countries are Indo-Pacific nations with whom Australia has very important and valued strategic relationships. So we are absolutely committed to working in partnership with those countries. So with making sure that our research team is balanced with people who live and work in those nations, as well as the multidisciplinary wider CEVAW-based team, and that seeks to the greatest extent possible to understand the context socially, politically, economically and culturally, and how this might influence the things that we're finding. My location is in a school of public health, and that means by definition our work has to draw on the insights of many disciplines. I work with people who are biostatisticians, epidemiologists, political scientists, people involved in other parts of psychology, developmental and educational psychology, and very definitely people with interests in gender and risks to gender-based violence. So all my work is interdisciplinary, and I think I'm absolutely committed to that as being the very best way to understand and address complex object problems like violence against women. There are quite significant inter-country differences in what is defined as being Indigenous. So my Vietnamese colleagues say, well, all of us are kin in Vietnam. That is the dominant population group. They are Vietnamese nationals, and then there are some ethnic minority groups. So the idea of indigeneity is not experienced in the same way in every country. So what we've done to address that is to seek to understand it as best as we can from their perspectives, and to be very respectful of making sure we include Indigenous co-researchers in this work, and we make sure that any interpretation we have of what we're finding is done through a local Indigenous lens. Collaborations both within the CEVAW group and with CEVAW partners are just foundational to what we're doing. So for each of these 3 systematic reviews, one each in Fiji, Indonesia and Vietnam, we have a team of people who are both CEVAW investigators and people working as local partners, and students and research fellows who are working in CEVAW and have particular interests in those areas. And we've really shared the work of searching the literature, extracting the data, undertaking the critical appraisal of it, and then meeting very regularly to discuss differences of opinion, differences of interpretation, and then doing the work of how do we bring this together, how do we take it from being a complicated organic entity into something that's communicable and of value both locally and internationally. And they are people from very different disciplinary backgrounds, some of whom are familiar with this method and some of whom have never used it before. What we've discovered in these literature reviews is that really there is a need for, firstly, nationally representative research that asks people about their experiences in ways that are replicable. And the other thing we want to do is follow a group of people over time to see how does this play out. Are there experiences at one stage of life that make people more or less vulnerable to future experiences of violence? So what we are planning to do, and we're getting close to being able to launch this, is to do a survey of young people in their final year of school, and then to ask them to complete follow-up surveys at 18-month intervals after that. And we hope to do 3 waves of that. And we're starting with young people who might not yet have experienced violence perpetrated by an intimate partner, but are likely to have experienced other forms of violence within their families or at schools or from their peers, or cyberbullying and other experiences. And we still don't know very well how common those experiences are, and then do they bring vulnerabilities to adult life, and are there things that we can learn from that can help inform prevention efforts. I very much hope that new evidence, well communicated, is influential locally and internationally. So I would hope that the new evidence is useful to policymakers and advocates and government decision makers in each of these 3 countries in their own efforts to try and counter this problem and reduce it. And then internationally, we hope that it will contribute to a small body of existing prospective research that has followed people over time, and will therefore contribute insights into what might be factors common to every country and what might be some that are more culturally or nationally specific, so that these can really help nations with their own programming and planning. My background is in clinical psychology, and so my early experiences were meeting people whose lives were very difficult, who were experiencing grave distress. And I came to the view fairly early on in my own career that it would be much better to seek to prevent these problems than to seek to address or assist them once they were established in someone's life. And if you work in mental health, it doesn't take very long to discover that experiences of violence and abuse are the common risk factor. And this is either experiences in childhood or adolescence or later in adult life. So understanding and responding to gender-based violence is just foundational, I believe, to any work seeking to improve mental health at an individual level or a community level. And yet it is still neglected. It still really concerns me that too many of my peers in mental health services are not conversant enough with this link, and so it's really clear we have to keep doing research that is persuasive and compelling in its own right.